Hello, good evening. Welcome to Your Health Matter OC. This is Dr. Clayton Chow. With me tonight is Miss Jenna Seven, standing in for Dr. CK. By the way, just in case you're wondering, Dr. CK is really watching the show right now. She's recovering well, and so we are so thankful for that. And for those of you who have shared concern or sending question or have emailed me and text me and asked about Dr. CK, thank you for your concern. She's watching, so she know. I'll tell you who asked Dr. CK, but glad to hear that she's doing well. Tonight, the topic is really important. It is about fentanyl awareness and prevention. And it is a privilege for me to introduce you to our guest speakers tonight. Ms. Perla Mendoza, Executive Board Member of Void, President Project Eli, and Mr. Jaime Bueta, President of Void. We'll talk to them in a minute. In the meantime, if you need to send in question to us, just send us an email at yourhealthmatters@ochca.com. Again, the email address is yourhealthmatters@ochca.com. Before we get right into the topic, let me give you an update on where we are in terms of COVID. As you're probably expected, we continue to be pretty significantly impacted with the number of people who tested positive for COVID. As of today, our case rate is about 32.1 per 100K. And as I have mentioned before, this number is underreported because cases where people tested positive using the at-home or take-home antigen test is actually not reported to the state system, or people just don't call us. And even if people call us and let us know they tested positive with the antigen test, it doesn't get reported to the state because the state only posts the positive PCR tests that are run by the laboratory. So just want to let you know that even though the number is at 32.1 per 100K, that is a low reported number. The 7-day case average is about a little bit over 1,100 a day, and our positivity rate is at 17.4%. If you remember 2 weeks ago, or even if you follow our dashboard from last week, this is an increase over last week. However, the hospitalization continued to be low, even though there's an increase from last week, where we were at 250. Today we're at 287, with 28 people in the ICU. The number of people who are in the hospital who are unvaccinated is 83%, and the people in ICU who needed that level of care because of COVID, 86.8% of them are unvaccinated. This speaks to the importance of the vaccine, and I know I'm speaking about this all the time, and that is the only way for us to get out of the pandemic is for really people who qualify, eligible for the vaccine as well as the booster to get vaccinated. So hopefully this message resonates with you all, especially those who, for one reason or the other, are still not vaccinated. As recently, we talked about how the vaccine are now eligible for kids 6 months and above to even get vaccinated. We don't have the total number of kids over the age of 6 months to 4 or 5 years old who vaccinated, because this is new. So in a couple of weeks, we will have the number to report to you. But just as a reminder, number of people who are fully vaccinated in Orange County is over 2.3 million. People who receive booster, over 1.3 million folks. At least 39% of our 5 to 11-year-old have received one dose, and 34% fully vaccinated. When you look at the teenager 12 to 17, 74% get at least one dose, and 68% are fully vaccinated. So thank you so much for those youngsters and their parents who wanted their children to be vaccinated. And we are continuing to be proud that 100% of our seniors over the age of 65 have seen at least one dose, and 95.6% of them are fully vaccinated. So I think That is good news for us. Again, if parents, if you want your kid 6 months to 4 years old to get vaccinated, they can either choose a Pfizer vaccine, which requires 3 primary series dose, and if Moderna is 2 dose primary series. For 5 to 17, for Pfizer is 2 dose, and for Moderna is 2 dose. So that is just a reminder for parents that your children are eligible. Please discuss with your pediatrician if you have any questions or any concern about the vaccine for your child, whether or not it's appropriate for your child. Have a conversation with your pediatricians, okay? For a COVID vaccine, 6 months to 5 years, if you really want to find out where to get your child vaccinated or register your child to get vaccinated, obviously Othina.com can help you with that, or vaccines.gov can also help you to schedule a vaccine for your kids. But any of the big chain pharmacy like CVS, Walgreens would also offer clinics. I know it's very easy. My niece and nephew, youngster, my sibling, their parents went on to a CVS website and got them vaccinated in no time. And so there are many ways of getting the vaccine: Othina.com, vaccines.gov, or any of the big chains pharmacy would also give you information as to appointments, date, time, etc. So it's very convenient. If you still want to get tested, remember the government now, the federal government now has allowed each address, that's a very important piece, each address to register and get the take-home antigen test round 2. And remember, round 1, each address are entitled to 8 take-home tests. Round 2, again, each address will be allowed to register for 8 tests, take-home tests, but it will be shipped to you on 2 separate shipments, 4 and 4. Okay, so in case you don't know, those are available. And then for those of you who have insurance of any type, whether it be government insured or privately insured, each person are entitled to 4 free antigen tests a month. You can go up to your pharmacy and pick them up and show them your insurance card. If for any reason you need more than 4 a month, and then you can always get a prescription from your primary care physician to get extra antigen take-home tests from the pharmacy. So widely available. We continue with our approach in how to manage the pandemic, and that is assess your own risk, right? If you are an individual who have risk, or you live with somebody who has risk, like myself, I'm living with my mother in my culture. I live with my elderly parents, not the other way around, even though I paid the mortgage, right? But if you live with your elderly parents or people with that risk, you really need to assess your own risk and do the appropriate thing, right? Like I wear a mask when I'm indoor and make it out of a habit. When I go into supermarket or places where I don't know people vaccine status, I put on a mask, right? I want to make sure that I protect myself to protect my elderly mother, even though she's fully boosted, completely boosted. She's immunocompromised, so she got 5 shot now. So for those of you who are immunocompromised, just remember you are entitled to 5 shots, okay? So do the appropriate thing. If you're sick, please stay home and get tested. We just talked about how easy it is to get antigen tests, so please do so. We will keep you updated, continue updated with all the new information about the pandemic and what have you. But thank you for doing your part. Thank you for getting vaccinated, and thank you for caring for those who are vulnerable, including children. So thank you so much. So let's go back to the topic of fentanyl tonight. As you all know, it has been a crisis on top of the pandemic. And these are crises that are really deadly. Before we go to our guests, Jenna, you want to share with us the statistic a little bit?
Sure. Thank you, Dr. Chow. And thank you both so much for being here and the opportunity to work with you and certainly with your organizations. I think that it's really important to note that fentanyl was essentially non-existent among overdose deaths in youth under 18 until recently in 2019. We have seen that youth in the 10 to 17 year age group, we've seen a rise in fentanyl-involved overdose deaths from 0 in 2017 to 19 in 2021, with even 1 death occurring in 2020 for someone under the age of 10 age group. So staggering and certainly devastating. Young adults, this is really, I think, tragic that in our young adult population, we've experienced a 550% increase in fentanyl-involved overdose deaths from 2017 to 2021, going from 12 to 78. And we are also seeing these marked increase in our adult populations as well. I know we're going to spend some time talking about our youth today, but it is certainly a national of concern, of tragedy and the implications. And we're just so grateful to have you all here and partner with some of the work that we're doing. And later I will share some of the work that's happening within our agency at Dr. Chow's leadership. So thank you.
Perla, Jaime, thank you so much. I know Perla for a long time now. When we did outreach to the populations that you are now strongly advocating for. And we'll get into Perla's story. I tell you, when Perla reached out to me and I listened to Perla's story, I was shocked. Sorry, I really get emotional. Not supposed to be so soon. It's just because I feel that connection with you, Perla, and I deeply thank you for coming to talk to us tonight. I know it takes courage for both of you to do this, and my hat's up to both of you. First off, tell us a little bit about Void and why you started. First of all, what does Void stand for?
Thank you so much for having us on your show. We truly, truly appreciate it. We are honored to be here. Void stands for Victims of Illicit Drugs. We are a 501c nonprofit based here out of the state of California. We're a group of bereaved parents who have come together in advocating for our youth mostly. And what we are trying to do is trying to spread information and get the vital information into our schools and community colleges and colleges of the scourge that is decimating our communities right now, which is fentanyl. Most people believe that you will not lose a child because you don't have anybody who uses drugs in your family, or you don't have anybody who uses drugs recreationally. But the problem is that with fentanyl, it is used to deceit. It is deceiving children because what they are buying, and I'll get into that a little bit later, but what they are buying is they think they're buying pharmaceutically grade trademarked pills such as Xanax or Vicodin or Percocet or oxycodone, when in reality they're pills made of binder and fentanyl, which is why you've seen these numbers go through the roof. So what our job is getting the information into our schools so that parents and students understand that this crisis can affect them and will affect them unless they have the information on hand. So that's what we're all about, just really spreading education in our schools.
So Perla, why did you guys create this documentary called Dead on Arrival?
Dead on Arrival was created to spread education and awareness to the masses. I was invited to take part of that, but I wasn't as active in creating it or establishing, the connection with the producer. But Jaime, he kind of could speak to that a little bit more.
So Dead on Arrival was it was produced by Christine Wood from Orange County, and directed by Dominic Tierno. And they had reached out and had made contact with Amy Neville, who is very active in Orange County into schools as far as education goes with the children, and wanting for parents to participate on a documentary talking about the scourge of fentanyl. So they reached out to me, to Steve Filson, Amy Neville, and Matt Capilota. We are the four principal parents who participated in this. We flew to Idaho, Eagle, Idaho. They rented out a home and they did the documentary. We had absolutely no idea how it was going to turn out. We basically told our own stories, and Dominic Tierno, the director, just did a phenomenal job, because Dead on Arrival basically explains exactly what is happening in our communities right now. And it really brings an understanding not only to students, but to parents alike of what is happening in our communities. Most people do not understand what's happening. But if you watch Dead on Arrival, it's like a light bulb will go off and you'll understand exactly what's happening. So we were very fortunate to have been invited to be a part of this documentary. It was released in September of 2021. And since then, multi-level agencies are using it to spread awareness, not only in school and colleges, but also at drug prevention conferences, associations. We have LA County Sheriff Alex Villanueva has it on his website. I believe Sheriff Don Barnes has it as well. San Diego County has it as well. They're using it. And we're using it at CADCA and the Drug Enforcement Administration. We have a signed memorandum of agreement with them. They're also using it, and we're actually participating in some schools outreach with our film and to spread awareness into schools. So it is being viewed everywhere right now, and not because I'm in it or because Amy or anybody else is in it, but we are told that it is the most powerful documentary on the subject of fentanyl poisoning right now to date in the country. And we have it not only in English, but we had it dubbed in Spanish as well. Okay. And hopefully we'll get it. We're working on Vietnamese as well, Dr.
Okay.
Chow.
Let's talk about that.
Yeah.
But before we go on, let's show clips of this documentary, 21 minutes of powerful messages. Let's do the first short clip in the segment of the documentary that I think is very educational. So let's do it.
This would be how much cocaine somebody would have to ingest to kill them. This is the approximate number of prescription pills one would have to ingest to kill them. This is the amount of heroin the average person would have to ingest to kill them. Fentanyl. You're going to have to bring that camera up here real close to see it. This much fentanyl would kill you and I if we split it. They put fentanyl in cocaine. They put fentanyl in heroin. They put fentanyl, as we already know and talked about, into counterfeit pills. It's odorless, it's tasteless, you don't know it's there. And when you find out it's there, it's too late. You won't even know it. You'll be dead. 2,500 people would be killed by that amount of fentanyl. Does that sound like a drug to you? Does that sound more like a poison?
Welcome back to Your Health Matter OC. Tonight, the topic is fentanyl, and we have with us two incredible parents, an incredible speaker. If you have any question, please send us an email to yourhealthmatters@ochc.com. yourhealthmatters@ochc.com. If I may, would each of you share your own personal story?
Sure, I'd love to. I'll try not to get emotional, but anytime that I speak about my son Daniel, I do get a little emotional, as I am right now. My son Daniel is 16 years old. In the height of the pandemic, we believe that he reached out to a drug dealer through Snapchat on March 31st. That night, we had a wonderful evening. And we had dinner, and the next morning when I walked into his bedroom, I found him dead. He was brought back to life, but he was sent to Los Angeles Children's Hospital, but he was completely brain dead, and there was nothing that we could do. Just a little backstory on my son, Daniel. My son, Daniel, was not somebody who was addicted to drugs. He was not somebody who was within the substance use community, per se, but he was a young man who suffered from depression and ADHD. And we feel that at the height of the pandemic, I think what happened is he got bored. And like most kids who make dumb decisions, decided to go into Snapchat and thought what he was buying was a pharmaceutical grade 30 milligram blue oxycodone pill. But in reality, what it turned out to be was a pill just made of binder and pure fentanyl. Los Angeles Children's Hospital had turned over half of the pill that I had found on top of his dresser and turned it over to Santa Clarita Sheriff's Station, and they did an analysis of it, and they told me that there was enough fentanyl in that pill to kill 4 grown adults. So when the sheriff came to me and told me, "We're sorry, Mr. Puerta, but your son died of an overdose," first question that came out of my mouth was, how do you explain that a perfectly healthy 16-year-old boy who took half a pill dies of an overdose? And he goes, tell me, please, what pharmaceutical grade pill is out there right now that if a child takes half a pill that they can take their lives? And the answer was, well, there isn't none. And go, well, then this was not an overdose. This was a poisoning. My son was deceived into buying what he thought was an oxycodone pill, but in true reality it was fentanyl. So my son passed away on April the 6th of 2020. His mother, Denise, was in a hospital bed with him, stroking his beautiful sandy blonde hair. And I was holding his hand when he took his last breath at 5:08 in the afternoon. And then he passed away. Then I had to drive home. And then that's when my journey began as far as advocacy and awareness. And I can get much more into it, but I know you don't have a lot of time. But that's how I got into this fight. One of the first things that happens to you as a bereaved parent is that you feel alone. You feel like there's nobody out there, that nobody will understand you. And due to the stigma of addiction and overdose, especially within the Hispanic community, I'm Colombian American, people do not want to talk about it. But once my son died and I went on the internet and started looking, I just found cases over case. I just found so many parents who had the same experience with their children dying as well. And the first thing you ask yourself is, why do we not know what is happening in our communities, and how is this happening, and why weren't we warned? You know, so that's when we started. I started getting to work, and then and just really trying to get the messaging out there. We feel that there's a different. I'm not saying your administration or your office, but we feel like there's a disconnect with our information getting into the children's hands, which is why we feel like the numbers keep going up in drug deaths. So we can talk a lot more about that if you'd like, Dr. Chow, but I'd like Perla to talk about her son, Elijah.
Perla.
This is my precious son, my only son, Daniel Elijah Figueroa. And I also get very emotional, so I typed something out just to kind of help me stay on track. My son Daniel had a heart of gold. He had big dreams. He wanted to become a businessman with goals to fund world missions. His desire was to help others who struggled and hope that they would come to know the love of God. My son was raised in Los Alamitos, California, where he attended school and excelled in academics and sports. He loved basketball, composing music, and singing. During my son's junior year in high school, I noticed a change in his mood. He seemed withdrawn and appeared to have lost interest in some of the things that he once enjoyed. I was at a loss to help him, so I reached out to his primary care physician, and they were able to arrange, a therapist to meet with him. After he began regular visits at the age of 17, he was prescribed medication to help with his anxiety, insomnia, and depression. Daniel did not like the idea of taking any pills and was concerned with the social stigma that surrounded people who took antidepressants. But after a few months, he started to improve, and the doctor suggested taking him off the medications to see how he did. My son was thrilled. However, after a few months, his symptoms returned, and they were worse than ever. Now he didn't want to see a therapist. He'd say things like, "I'm not crazy, Mom. Please stop trying to force this." But Daniel continued to struggle and eventually turned to marijuana. He said it helped him sleep, but I couldn't allow this self-medicating behavior in our home. And I tell him I know if I could smell it, While he was competing in track and field, he met some kids who were open about taking Xanax. Xanax use, as you're probably well aware, was very popular in music and the culture, and it was easily accessible in our neighboring community of Rossmore. Things that were once stigmatized had become popular through the culture and became a youngster's pastime. My son actually shared that thought and practice with me. He thought Xanax was okay. He said it mellowed him out, and besides, he wasn't hurting anyone. He thought it was safe because a doctor had prescribed it to him at one point, and he could finally sleep at night. But he did become addicted. And he caught us off guard, how fast he became addicted. Daniel agreed to get help, and during his treatment, the therapist found the root cause of my son's pain. My son revealed that he had been sexually abused by paternal family members before the age of 5. My son decided not to confront his perpetrator at the time. His goal was to heal and strengthen his relationship with God. And I respected his decision, but I hope that, justice would have been served one day. My son completed treatment in July of 2020, and despite the fear of COVID, he found a job and enrolled himself into college. He was doing well, and I was really proud of him. In September, he started complaining about insomnia again and reached out to his doctor for help. But because of his prior addiction, his doctor was reluctant to prescribe anything to him. He did encourage him to continue with his support groups, which he was an active member of the NA community. And he tried everything. He tried exercising, meditation, but nothing seemed to work. On Snapchat, he discovered someone who was selling Xanax. And on September 15, my son reached out to that person. The person that he reached out to was recommended by a friend. So I think my son felt safe and confident that what he was asking for was legit. However, that night, my son died after taking one single pill. I know that because he ordered 15 pills that night. It was part of their agreement. And we found 14 of them. It turned out that every single one of those pills contained a lethal dose of fentanyl. So any one of those pills would have killed him or someone else.
It's one of the things, and if I may, Perla, is that, Bill Bodner, who's the Drug Enforcement Administration's lead officer in Los Angeles, I believe Orange County as well, 4 out of these 10 pills that are bought, everything bought off of social media, 100% of all the pills are counterfeits. You're not going to find a pharmaceutical grade pill on social media. You're not going to find it on Snapchat, on WhatsApp, on Meta, anything like that. And these children do not know that. Pill usage has been very normalized for a lot of these children. I'm 60 years old. My son had ADHD and severe depression. I had never heard any of my friends back in 1980 of the class of Burbank High who had either ADHD or severe depression. These children, are taking medication. Not that there's anything wrong with it. My son had to take medication as well. but we have kids on Adderall, Ritalin, Xanax, and they feel like the magic elixir or what's going to make them feel good are these pills. And when they don't have these pills, a lot of them will go onto social media apps like Snapchat, buy what they feel is a pharmaceutical grade Xanax or oxycodone or Percocet, when in all reality, they're counterfeits made of fentanyl. So when you talked about the statistics in the Orange County of these drug deaths, that you hadn't seen anything in children under the age of 18 until 2019, I can tell you that is the largest segment of society that is being overlooked right now because it is decimating these children. There's kids just dying left and right because of this, and parents don't know this.
Yeah, I had no idea. I mean, as you know, I worked in the healthcare agency for many years, and most of my experience has been with people who suffer from addiction. So I thought I was well informed. I made it a point to educate my son at a very early age, and all the things that we talked about and that I warned him about, he wasn't into. He wasn't into, certain drugs, and I'm not trying to, categorize or add to the stigma that's already associated with addiction and use, but I thought we were fully aware of everything that could have caused him any harm, and fentanyl just kind of came out of nowhere for me. I had never heard of it. Moments after I arrived at at home the home where he passed away at his grandmother's house on his knees in a praying position. And immediately after he was removed, and I got a phone call from a detective that said, most likely your son passed from fentanyl toxicity. And he started to share. I said, well, where did this come from? How would he get it? And my fight began right after that phone call ended. I needed to know what fentanyl was. Why hadn't I heard about it? My son had been in treatment, and while he was in treatment, we participated. My husband and I would attend, the group classes. We were very active in supporting our son, or my son, and this was not a topic that had ever been discussed, and quite frankly, I was really surprised. So, initially it started out with, okay, well, who's responsible for this? His, dealer is a young boy from Santa Ana who has not been arrested and may never be arrested. So I said, okay, well, like Jaime says, we can't arrest our way out of this. So I said, okay, well, how can I get involved? And, I began doing what I could individually, sharing what I could about fentanyl, and then I joined forces with other parents, and, well, here we are. And it's been such an eye-opener, for me, and my goal now is to educate our community. I live in Orange County. When I first started to process what could I do, I felt, in my spirit that I needed to start home, and home is Orange County for me. And so this is where I began, and I'm just, willing to do whatever we can these days to educate our parents and our young people and bring some attention to the subject matter.
Probably for, sorry. Well, for me, your story is so powerful because I know who you are, and I remember when we worked together, and if I could just hold your hand, you just helped so many individuals that struggling with addiction. I mean, you were there. You were supportive of them. So when I heard this story, it has to be a poisoning, accidental death that your son had no idea that he was being poisoned.
I've asked, I questioned, maybe there was something that I missed. I asked friends, did my son like fentanyl? Was he into it? Nobody seemed to know what the heck fentanyl was.
Yeah.
And
Well,
and that's an important piece, Jaime, is that children nowadays, and because of the lockdown, because they have to rely on technology, to continue their education, they're really exposed to things that they shouldn't be exposed to, like communicating with friends on Snapchat, being set up or being preyed on by
Predators.
cellular, right?
Well-
Whether or not the boy you talk about knew that he was selling fentanyl to your son, that's a different story. But nevertheless, the people who produce these type of poisons need to be taken to justice, and they need to stop. Because if you look at his picture, full of promises, full of potential, and is robbed, basically robbed.
My son was only 16 years old. And the difference between, first, we have to understand that fentanyl has changed the drug landscape like no other drug has in the history of the United States of America. Even more so than the opium at the turn of the century, more so than the crack cocaine epidemic that we had within the 90s. Fentanyl it's here, and it's going to evolve into another analog. I can guarantee you that, because they're gonna change the chemistry of it, and they're gonna do something else with it. But to your point, Dr. Chow, I always say, when I first got into this fight, I wanted vengeance. I'm a Marine Corps veteran. It was the first thing that came to mind is I needed somebody to pay for my son's death. Do I condone my son's decision on wanting to self-medicate or try this pill? Absolutely not. But he didn't deserve to die for it. It's not like back in the 70s or 80s, or, you made one bad decision and, you'd live to tell the day and you would say, I liked it or I didn't like it. Before, for you to end up homeless and addicted to drugs and living on the street, it was one bad decision after the other, after the other, after the other, and live a life of addiction 10, 15, 20 years. Correct? Not now.
Yeah.
Now it's only one bad decision, which can take the life of a young man or woman or child. I mean, we know of victims as young as 10, 11 years old that have died due to fentanyl poisoning, but they didn't know that they were consuming it. Again, they're being deceived. They think that they're taking a pharmaceutically grade pill, but in all reality, it's a fentanyl and with some kind of binder. So this is not only happening in Orange County, it's happening all through Southern California.
And if I may say, fentanyl is in fact the deadliest thing to ever hit the black market.
Well, and it's very important. There are people who say, well, but it's used in hospitals. So there's we have to distinguish between the two,
right.
correct?
Right.
Because there are a lot of people who live with severe and chronic pain throughout their lives who need these analgesics so they can at least function in life.
But under control of a physician.
Correct, Dr. Chow. Under control of a physician, we're talking about people who have had chronic illnesses, end-stage cancer treatments, or severe, horrendous injuries, right? Those are the ones that are supervised by a doctor in a medical setting or a hospital setting. The fentanyl that we're talking about has nothing to do
With those medicines.
with those medications or what that's being taken in a hospital. We're talking about illicitly made fentanyl that is being produced by transnational organizations and who are marketing it and distributing it through social media platforms.
Yeah.
Period.
Let us take a look at the final clip
Okay.
of this documentary. And then we'll talk about how do we share this information.
Perfect.
The final clip. So let's take a look at the final clip.
So my question for you is, are you going to listen? Or will it be your family and your friends holding your picture, wishing they could have been there to tell you?
This is my son, Alexander. He died at 14 years old from fentanyl poisoning.
This is our daughter, Jessica. She was 29 years old when she was killed by fentanyl.
This is my daughter, Alex. She was murdered at 20 years old by a drug dealer who sold her a counterfeit pill made of fentanyl.
This is my son, Daniel Joseph Puerta Johnson. killed at the age of 16 by illicit fentanyl.
This is my
This
son.
is my son, Daniel.
Thank you, everyone. Welcome back to Your Health Matters OC. Tonight we are talking about a very important topic, and that is the fentanyl poisoning in our community, especially youngster in our community. There's so many questions that I know we don't have time to go over, but the most important question is there an ability to test out illicit drug, whether or not it contained fentanyl?
That's an excellent question. And it's a tricky answer, Dr. Chow, especially when especially when you're talking about illicitly made pills, because there is no common way of making them. In other words, they're not compounded like they are in a pharmacy, or you know what I mean? They're illicitly made. So there's absolutely no quality control in making these pills. So first of all, to grab a pill and test it, you would have to crush it and put it in water and then put a fentanyl test strip in it, right? Whereas one pill might not have any kind of fentanyl in it, another one might, right?
In other words, if I was going to buy pills like your son did, there is no easy way for me to test each pill before I take
they
them.
do have fentanyl test strips available, but they're not 100%, guaranteed. It is a form of harm reduction, but it's not a guarantee that you're going to get an accurate read.
Right.
Or, they may test one, and like Hyman mentioned, that one may come out negative because, according to the DEA, 1 in 4 pills are a lethal dose. So they might test the one that's negative, that's safe, and then the rest.
Right, or one side of the pill might have 2 milligrams or more
of
fentanyl, and 2 milligrams is enough to take your life, and the other side of the pill may not have any.
So a youngster, sound like a high schooler, sent an email and asked, it looks like my friend could be abusing illicit drugs. Is there a sign to show that he or she's abusing fentanyl?
It's a great question as well. Unfortunately, if fentanyl does not take your life the first time, you automatically become addicted to it. I mean, 2.5, 3.5 hours after having consumed it for the first time, your body is wanting to take it again. So yes, there's a very drastic change in mood, irritability, bouts of angry, aggressive behavior because they are not getting what they want. I would actually, call a physician as soon as possible, get the help that you need. It's not their fault. Like I said before, fentanyl has changed the drug landscape like no other drug has before. And these children, unfortunately, if they're not dying on the first go, they're going to become addicted to it immediately.
I'd like to add, though, that if you suspect that someone is using fentanyl, there is Narcan available that can help counteract overdose. And Narcan is supposed to be available for free. There's different sources that offer it, and if you want, you can reach out to Boyd, and we can help link you up with those resources. But I would suggest that if you suspect that your child, your roommate, your best friend is using, that you carry that Narcan like you would in your first aid kit. I tell parents, put it in your first aid kit. If you know your kid is experimenting, another thing is recognizing the signs of overdose. I think many people have died and they've been around others, and those people will think, that person was asleep. I heard him snoring. I thought they were asleep. So I thought they were sleeping and couldn't wake up. But recognizing those first signs of overdose is so detrimental. It can save someone's life.
We have you have college students who are in the practice of, because they want to perform in a high base, they'll take Adderall, for example. And, unfortunately, we've heard of straight A students, pre-med students, University of Ohio. I mean, look at the 6 cadets from West Point. I can give you example after example after example of university students who purposely are taking these pills thinking they're going to have a better outcome with their studies, but in all reality, there's fentanyl. And then you also have the cross-contamination, unfortunately, for recreational drug users who like to use cocaine. There's a cross-contamination with fentanyl on the scales that might be included with the cocaine, and they go and consume cocaine and they die as well. Before they would tell us don't do drugs, and you kind of laugh it off and go, they're being a little bit too over dramatic about it. But in today's day and age, that message
doesn't work.
is so important now, because now you can lose your life.
Yeah. I think for our youngster who are watching, and hopefully our youngster who have friends or suspect that their friend is doing drug, and the risk of your friend getting a hold of fentanyl is pretty high now, right?
Yeah, and I think it's
say,
so important. I encourage students to, if you're on social media and you see someone selling drugs, report it. You could save someone's life.
That was where I'm going to get at is, don't keep it a secret. You need to tell an adult.
Yes.
Really, you need to tell an adult, because it could mean saving your friend's life.
Exactly. Some people say, well, fentanyl isn't an issue. For me, if somebody would have tried to talk to me about fentanyl in the past, I may not have taken it as serious, because as far as I knew, my son wasn't into that. But you don't necessarily have to be into fentanyl or be addicted to die from fentanyl. And I think that's a key point, to kind of just remember.
Yeah. And I think that the burden on our youngster is, hey, I don't want to lose a friend and tell on him or her. But in this case, in both of your cases, if their friends know, you risk losing your friend, period, if you don't tell somebody so that they can get the help.
The lives of my family, the lives of my son's immediate influence is forever changed.
Yeah.
They still come to my house. Most of his friends were all girls.
Yeah.
He was a very handsome young man, but they would come to him because he was like an old soul. He'd love to give, relationship advice per se, but they still keep in touch with us, but their lives will never be the same. And that's what's so sad, is that you look in Orange County and LA County, you could throw a rock in any direction that you want, and you will find somebody who has been directly affected by the fentanyl scourge in the communities, whether it's an immediate family member, a distant family member, cousins, friends, a friend of a friend. You will find somebody who's been affected by this. When I was in high school, nobody died. Now you talk to children, and they know 1, 2, 3 people who have in their immediate circle of friends, or they know of somebody in their high school or junior high school who has passed away to this.
I know you have presented and talked about this topic across the country.
Yes, sir.
Do you find that every community is pretty much the same? The stories, the way kids got a hold of fentanyl, and the way they died.
They are so surprised. When they watched the documentary, it's like they were hit over the head with a sledgehammer. They weren't expecting something this powerful, because they just have absolutely no idea that this is in their communities.
Jenna, you were talking about having conversation with our Chief of Mental Health and Recovery Services, Dr. Ronnie Kelly. What is the plan?
Yes, so I know we have a few things coming up, of which we're working with a variety of our community partners. We're planning to hold a fentanyl town hall on National Overdose Prevention Day. This will be on August 31st, with subsequent town halls in each supervisorial district. And of course, Void will be participating. Additionally, we have a number of contracts with community providers, including the Orange County Department of Education, who are working in our schools to prevent misuse of substances, including a media literacy focus that will help youth understand the dangers of social media purchases, as well as the component to educate parents on the new reality of fentanyl poisoning. I think another resource I would love to be able to share is that mental health and recovery services offer a wide range of both prevention, treatment, and recovery support for Orange County residents. And that can all be found at our website, which is now listed up on the screen, www.ocnavigator.org. And again, that's www.ocnavigator.org for families that are seeking support, have questions, need information or services that we can support this.
But if they want to find treatment for their loved one,
Correct.
You can always call OC Links. That is 855-625-4657 or OC Links, right? So go on your phone pad and type in OC Link. Again, if you want to seek treatment for your children or have questions with a live clinician, contact OC Links at 855-625-4657. I am so looking forward to working together with Void and particularly with the two of you.
Thank you so much, Dr. Chow.
To really show the documentary, number one,
Yes,
and then to have a panel discussion with the community.
that would be great.
And as you mentioned, we have planned for a town hall meeting, and then hopefully each of our supervisory district, we will hold one viewing of the documentary.
Perfect.
And a panel of discussion. And I'm hoping that those of you who are watching share this. Be on the lookout of those dates that we're going to roll out on our own website. ochealthinfo.com is the county health agency website where we make announcements of events and what have you, and we will ensure that the Orange County Department of Education, their website would also list. I hope so. We have good working relationship with OCDE, and we will work with them to really share the information as to these important dates.
That's
for the
perfect.
viewing.
And if you could go to stopthevoid.org.
Stop the void. You will be posting those.
Yes,
those dates. Okay.
stopthevoid.org. You will find a documentary there, both
Right.
in English and in Spanish.
Great.
And like I promised you before, I'll try to get it in Vietnamese as soon as possible.
Well,
as
let's work together to get it
Okay.
in Vietnamese,
Okay.
Yes.
Korean,
Perfect.
Chinese, those
Yes.
Threshold language in Orange
Perfect.
County.
Yes, sir.
Because I don't know about other county, but Orange County,
Yes.
we must make this our priority. We got to educate our parents. There is no shame in talking about this because this will save life.
Yes, sir.
Not your own children's life, your neighbor's life, your relative's life, and I really mean it, right? I mean, I have a nephew who's on social media all the time, right? And it just frightened me that what kind of information he got from there
The
and what
exposure.
have you. Yeah, exposure. So parents, you really need to learn this because this will not only save your children's life, but save their friends' life, save our children. Let me put it that way.
Yes, sir.
Save our children's life, right?
Perfectly
Those
stated.
precious life. Can you just zoom into, if we may, zoom into his picture, if we can. This is a precious life lost. One life too many. Thank you, Perla.
Thank you.
Thank you, Jaime, for coming to talk to us. We will see more of you.
Thank you, sir.
Thank you for your time. I know you're doing this on your own precious time that you can spend with your family, but you're doing this for the community. Thank you. Thank
Yeah.
you.
Thank you, Paul.
Now I'm going to get emotional again.
Getting me emotional too, Dr. Chow.
This is like such a, it means the world to me.
Yeah.
Thank you.
I never thought I'd be back in this building,
Yeah.
and so just to know that you were willing to listen and invite us here,
It takes a village to take care of our
does.
community, of our children. That's what that means. Okay.
and that's
Thank you so much.
my only goal now. My only goal is to try to help other people, not be embarrassed. I was embarrassed to
Nothing
talk
to
about
be-
it.
Nothing to
Embarrassed.
be embarrassed about.
We at first, like I said, I wanted to arrest our way out of this, and our law enforcement is doing a fantastic job in trying to seize as much and getting this off of the streets as possible. But we've come to the conclusion that the best way to abate drug deaths and within our communities is by putting the information into parents and children's hands. That's the only way we're going to be able to stop this. And so we're very honored that you had us on your show today, that you gave us the opportunity to speak about this. And for parents, that we're not trying to scare you, we're not trying to be alarmists, but if you look at the numbers, just look at the numbers nationwide. 2021, what do we have, 90,800. And then in 2021, we have 108,000 drug deaths in the United States. 71,000 of those were all related to fentanyl. And the preliminary numbers for 2022 are coming out now, and they're horrific.
Yeah.
Horrific.
Yeah.
So the numbers continue going up, and the only way we're going to get those numbers down is by educating the masses. That's the only way we're going to do it.
Yeah. And it's an honor for me, for us,
Absolutely.
that you take the time to come and talk to the public and talk to us.
Absolutely.
And together we can do this. We have to stop this.
Thank you, Dr. Chow.
So-
Thank you.
Thank you for watching tonight. Please, until we have all of those viewing with live discussion, meaningful discussion, you can watch the documentary on stopthevoid.org. Stopthevoid.org. Spread the news, spread the documentary, watch it together with your family, right? Especially your youngster. This is so important. This can save life. This is not no mean by scaring tactic, but this is the reality, the truth. And these parents are willing to share their story so that you can save your children, so we can save our children together.
Yes.
We have to do this. So thank you for watching. 2 weeks from now, on July 26th, we will discuss the topic of children's wellness from nutritional tips to physical activity tips and what have you. So see you in 2 weeks. You can send in question ahead of time. Your Health Matters at OCHCA.com. Again, Your Health Matters at OCHCA.com. On behalf of Jenna and Dr. CK, who's watching at home, thank you again, Perla and Jaime.
Thank you.
And
Thank you.
thank you. Have a safe evening. Thank you.